In this video, we're going to ask a physician 5 questions about what you should do if you get shot. Also, be sure to stick around to the end of the video as we're going to be doing a gunshot wound care kit giveaway. So the first question is, what is it like to get shot, and what is the first thing I should do?
The question is, what's it like to get shot, and what's the first thing I should do? Although I'm happy to tell you that I can't say from personal experience, there are numerous first-person reports that you're going to find online. There's even a subreddit for gunshot wound survivors. It has a wealth of information on it. You'll hear some describe that it's like being hit by a sledgehammer with a feeling of incredible pain, I can imagine. But others say it's a thump followed by an intense burning sensation instead. Still others say they feel next to nothing until later on. This all probably relates to the type of ammo, the part of the body that's struck, the nerves damaged by the round, even the state of mind of the victim. Then there's a sensation of panic that you feel from realization that blood is leaving your body and it's drenching your clothes. What you won't hear people say is that getting hit by a bullet sends you flying across a room, like in the movies. But why not? Being knocked off your feet by a stiff uppercut is certainly a possibility. You might expect the same thing to happen when being struck by a bullet, which travels much faster than a punch. But it doesn't. One reason is that unlike your fist, a bullet is streamlined and designed to minimize the effect of aerodynamic drag. As such, it concentrates a huge amount of kinetic energy onto a very small area. This helps it penetrate the target's surface, but to be blown back, you need momentum, not penetration. Momentum equals mass times velocity, and since a bullet is so small compared to a human being, its momentum is not enough in most cases to knock a person off their feet, although it can certainly knock you a step backwards due to surprise, panic, loss of balance, or pain. Think this way, unless you're wearing body armor plates, you're not really stopping a bullet, you're catching a bullet. Think of it that way. The effect of bullet wounds in terms of incapacitating a person is called ballistic trauma. Each bullet will cause damage due to permanent and temporary cavitation, yaw, tumble, fragmentation, and deformation of the round. You'll find more on ballistic trauma in our Survival Medicine Handbook or at doomandbloom.net. But for practical purposes of getting stopped in your tracks, it depends on where it hits. A direct hit on the femoral artery of a 300-pound man's leg may kill him in a few minutes, while several rounds to the torso of a 150-pound man may actually have little effect, at least at first, as long as it doesn't hit a major vessel. In normal times, the first thing you should do if you've been shot is simple. Call 911. If that's not an option and no one is around to help, your main concern is stopping the bleeding. The most likely reason you're going to die is hemorrhage, and if you can get a handle on it with direct pressure or a tourniquet, you'll have a much greater chance of surviving the event. This may not be easy depending on where you're shot. Any bullet that damages the heart or brain leaves you with about a 9% chance of survival. Injuries that keep you conscious longer give you the opportunity to intervene on your own behalf and have a greater chance of survival, especially if you can access a hospital early. If that's not an option, as in a survival scenario, expect Civil War era death rates. About 70% for serious penetrating chest and abdominal wounds, 54% for injuries requiring an above-the-knee amputation, 24% requiring an above-the-elbow amputation.
Question number 2. How much blood can I lose and still function?
Question is how much blood can I lose and still function? And by function I mean being coherent and not passing out. Well, it depends on how good your blood count was to start with. If you weren't anemic and had a lot of red blood cells carrying oxygen to the tissues, you can afford to lose more blood than someone who started off with a low blood count. Your consciousness is a function of getting enough oxygen to the brain. As long as you have enough red blood cells to carry oxygen to your brain, you should remain awake and be able to help yourself, although you might be in a state of panic. Now, this is why it's important, especially for women, to have a good source of iron and other nutrients in your diet to support red blood cell production.
Question number 3. How can you tell how much blood you've lost by physical signs and symptoms?
The question is, can you tell how much blood has been lost by physical signs and symptoms? You can certainly get an idea by what you're experiencing. An average size human adult should have about 10 pints of blood in their body. The effect on the body caused by blood loss varies with the amount of blood loss incurred. Let's say you've lost 1.5 pints of blood, maybe about 750 milliliters. That's about what we got there. Seems like actually quite a bit, doesn't it? But you know what? You can donate a pint or a pint and a half of whole blood to your local blood bank as often as every 8 weeks. Some people experience what's called a vasovagal response or might faint from it, but they quickly recover. That's pretty much the only physical effect that it would have. Now, once you hit 1.5 to 3.5 pints, that is about a 1.5, here you go, 1.5 liters, that's a lot of blood. Well, things start happening. Your victim is usually agitated with a rapid heartbeat and respiration. Now that's the body's way of compensating to get more oxygen to the body and to pump it to the organs. The skin starts becoming cool and starts being pale as a lack of red blood cells starts becoming apparent. Now at about 4 pints or so, that's 2 liters or so, now you're talking about quite a bit of blood here, you start having problems with the maintaining blood pressure. The patient appears confused. The heartbeat is usually very, very rapid. I once saw this in a patient who had been told that she was having a stomach upset, but then returned to the emergency room with a swollen abdomen, a very rapid pulse, a very low blood pressure, and was disoriented. She started losing mental status. As she was a young woman, I actually did a pregnancy test on her. It turned out to be positive, and this person was obviously bleeding internally. We went to surgery, and I found a pregnancy that implanted in the tube and had ruptured. And there were indeed 2 liters of blood floating around free in the belly. Now this person was in trouble, and anybody who has this much blood loss is indeed going to be in trouble. And as a matter of fact, once you get over that amount, you get over 4 pints, more than 2 liters, well, that victim is now very pale and could be unconscious. Now with continued blood loss, the blood pressure drops further, and now the heart rate and respirations, before very fast, begin to decrease, no longer able to maintain body function. Once you've reached this point, survival is unlikely without advanced help.
Question number 4. What should I do if I've been shot in the chest or abdomen?
The question is, what should I do if I get shot in the chest or abdomen? Gunshot wounds to the chest and abdomen are complicated, as direct pressure might not work to stop bleeding as it could in extremity wounds. In addition, elevation, which may help slow bleeding in an extremity wound, won't work in a torso wound, nor does being placed in the standard shock position with the feet 12 inches above the level of the heart. Nausea, vomiting, and shortness of breath may make it difficult to function. For a gunshot wound to the chest, you should recognize the signs of a sucking pneumothorax. This means that the wound is sucking in air into the chest cavity. If the air doesn't come out, it causes pressure that prevents the lung from inflating. This is also known as a collapsed lung. You can temporarily relieve this condition by placing a seal of some sort over the wound itself. It can be a plastic bag with tape on 3 sides. It could be a credit card, or in this case a medical license, taped on 3 sides, or it could be a commercial chest seal that is vented specifically to allow air out but not in. And of course you place it on the skin, not on the shirt. Your goal is to allow air to escape the chest cavity but not enter. Both the improvised and store-bought versions use the same mechanism to allow a collapsed lung to reinflate. In abdominal wounds, the intestines may protrude through the skin. In this case, place a moist cloth covering any bowels outside the abdominal cavity to prevent the tissue from drying out. If the intestines and other parts of the GI tract are damaged by the bullet, well, the contents will spill out into the belly, and that causes a severe infection called peritonitis. Very bad stuff. Accumulation of large quantities of blood that are loose in the chest or abdominal cavities is bad news. Hemostatic agents like QuikClot or Celox might be helpful if you're the medic, but it's difficult to pack your own bleeding wound, especially if it's through a small entry wound in the chest or abdomen. Without surgical intervention and advanced care, hope for the best, but expect the worst.
And question number 5, if I have a tourniquet, how should I use it and when should I use it?
The question is, if I happen to have a tourniquet, when and how should it be used? Well, not so long ago, tourniquets were considered as the last resort, and direct pressure indeed will stop most bleeding. But American casualties in Iraq and Afghanistan showed significantly better survival rates when tourniquets were used early in the treatment of a major hemorrhage. If it's obvious that arterial bleeding is occurring with bright red blood spurting out of the wound, you might consider a tourniquet as the first line of therapy.
Hi, I'm Nurse Amy. You haven't gotten to see me yet in this Answers from City Prepping, but I want to talk a little bit more about tourniquets before I actually demonstrate how to use them. So, where do you put a tourniquet? You're in an emergency, you're totally freaking out, and you look down and you say, oh my gosh, I'm bleeding. The most important thing is to get it close to the wound. You want to be just above it. So let's say we have a wound right here. We want to be about 2 to 3 inches right above the wound, but never on a joint. So you don't want to put it on your elbow or your knees. So that's a really important thing. Just remember, on tissue, not on joints. Now let's talk about some goals for putting on a tourniquet. You want to make sure that the bleeding has stopped and that the pulse has stopped if you can. Do not remove the tourniquet until the person is at the highest level of medical facilities available. That means you are not releasing and tightening that tourniquet over and over. Tourniquets are safe for up to 2 hours in place. Tourniquets should be transitioned to C-locks or quick clot with a pressure bandage put on top of it before 2 hours if possible. Do not completely remove that tourniquet while attempting the transition. Split the tourniquet limb to decrease movement and risk of rebleeding. Mark the patient with a giant T on the forehead with a marker or anything you have and the time on the tourniquet, and there's a couple of places you can do that. Now let's talk about the cat tourniquet. You're going to have your tourniquet set up so that you don't have to do all of this, and they recommend that you have your tourniquet set up approximately the width that you would want for your upper arm so that you don't have to set this up when it's time. So what you're going to do if you're by yourself is you're going to make sure that the strap is pointing this way because you're going to need to use your opposite hand to put it on. So you strictly put it on. Again, let's say our wound is here. We're going 2 to 3 inches above. You give that a nice tight pull and you want to secure some of that Velcro down. To check to make sure that this is tight enough, take 3 fingers and try to get under that buckle. If they slip in really easily, this is not tight enough and you're going to need to tighten that back up. But you're going to do this very quickly. If you're placing it on someone else, you need to do the same thing. After you do that, you're taking the windlass and you're turning it. Of course, I've tightened this up so much to show you that I'm strangling myself. So we're going to loosen it up. You would turn this and turn this and turn this. Either direction, it doesn't matter, until you see 2 things. We're going to go ahead and lock this in the windlass clip here. Again, 2 things. Bleeding has stopped, number 1. Pulse has stopped, number 2. So you would lock this in the windlass clip. You would bring the Velcro strap around, secure it in the clip, and then take the time strap and place that over. Now remember, you want to write your time and you want to put a big T on that person's forehead. So that's a simple way to use the cat. It's the same technique for putting it on the leg. Again, it used to be different because you would route it differently. You would go through it twice. This one is simply once. So that's really simple to do. That's the cat tourniquet. This is the Special Operations Forces tourniquet or soft T. You can adjust it easier if you're doing it two-handed on your leg. So that's why you want to make it adjusted for the widest part of your arm. When you place it, you need to put it tight. Again, you want to make sure that you can't get 3 fingers under there very easily. I'm going to loosen this again just a little bit so I can turn the windlass. You're going to turn this again looking for 2 things. 1, the bleeding stops. 2, no pulse. It's going to be a little bit harder when you're doing it on yourself, but mostly you're going to just watch for that. Now, once you've done that and this is in place, you can see that this was 1 step, twist, 2-step, 3, and lock it. The 4th step, which is a security screw, doesn't have to be done. So that's actually a pretty simple tourniquet. You don't have the additional step of bringing the Velcro band around over the windlass in that clip. So soft T and cat tourniquet. And that's how you use those.
You know, there's always a lot to learn if you want to be medically prepared, and sometimes you have to incorporate a different mindset if you think there might be a situation where modern medicine won't be there for you and your family. That's our mindset and what you'll find at our Top 10 Survival website, doomandbloom.net. You can also find us on Twitter at Prepper Show, see our videos on YouTube at Dr. Bones Nurse Amy, that's Dr. Bones Nurse Amy, and follow us on Facebook on our group, Survival Medicine, Dr. Bones Nurse Amy. There's also our podcast, A Survival Medicine Hour, on blogtalkradio.com, and of course, our best-selling book on Amazon, the Survival Medicine Handbook, 3rd edition, The Essential Guide for When Medical Help is Not on the Way. And don't forget to check out Nurse Amy's entire line of medical kits and supplies at our store at store.doomandbloom.net. Compare our kits with any others, and you'll agree they're the ones you want in your storage if the you-know-what hits the fan. Check them out. You'll be glad you did. Thanks for watching. We appreciate it.
Thanks again to Dr. Joe Alton and Nurse Amy of the Doom and Bloom YouTube channel. I'll provide a link to both their YouTube channel and their book in the description section below. So regarding the gunshot wound care kit giveaway, in order to enroll, it's pretty simple. All you have to do is go over to the Doom and Bloom YouTube channel and subscribe to their channel and post a comment in the comment section below. Now, if you're already a subscriber to their channel, again, you can also post a comment below. What we'll do is in 30 days from now, we'll randomly pick one of the comments below and pick that individual. And as long as you're a subscriber to their channel, you'll win. We'll reach out to you via email, and we'll also post a comment next to your comment alerting you that you have won. So be sure to check back in 30 days for that. If you have any feedback or any insight on anything that was discussed in the video, please post that in the comment section below, as I learned so much from your feedback. Also, if you enjoyed the video, please feel free to like or share on social media. As always, be safe out there.